Assess naman siya na.
Oh, go.
After that, assess the patients in a comfortable position and then select the site for injection that is free of lesion, free of inflammation, swelling, or tenderness. And now apply clean gloves. After doing that, we are going to clean the selected side using an antiseptic swab starting from the center going outwards. Ma'am, can you lift your shirt? Then we're going to prepare our syringe for injection. Uncup the syringe, pinch the skin, hold the syringe as if you're holding a dart, and then inject the medication into the patients. So we are going to inject the needle at a 45-degree angle. Okay, ma'am, I will inject na ha. Now release the pinch skin and then support the syringe, then push the medication. And after doing that, I'm going to remove the needle in the same angle as it was inserted. And if bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. Then dispose of the use of syringe into our waste receptacle. Okay, ma'am, how are you feeling?
Good.
Okay, good. So since we're done, I'm going to head out now and so that you can have some rest, okay? And then if you need anything, use the call button so that I can come back here and attend your needs. Okay, ma'am?
Okay.
So after doing the procedure, discard the gloves used and perform the aftercare of the equipment and proceed to the documentation of the procedure done. So now I'm going to proceed with the intramuscular administration of the medication. Administration is the introduction of the medication deep into muscle tissues where there is a large network of blood vessels that can absorb the medication readily and quickly. So after preparing the medication, head to the patient's room, introduce yourself to the patient, verify the patient's identity, and explain the procedure to the patients to ensure the patient's privacy. So good day, ma'am. I am Afea Rajulat Alvarez, your student nurse for today. And how are you feeling today, ma'am? Okay, that's great. So may I check your wristband and please state me your complete name and your birthday and age, please.
October 2, 20 years old.
Okay, ma'am. So today I'll be administering you the medication that has been prescribed to your doctor. It is a cortisone. It is an anti-inflammatory which will help you to your tendonitis. And I will be injecting this medication to your shoulder. Will that be fine, ma'am?
Yes.
Okay, so I'll just close the door so that no one will disturb us from doing the procedure and give you some privacy. Okay. After explaining the procedure to the patients, proceed with assisting the patients in the most comfortable position and select the site for injection. Now for the intramuscular injection, we have to select the site that is free of lesion, of inflammation, swelling and tenderness, and then apply clean gloves. After doing that, we'll have to clean the site of injection using an antiseptic swab, starting from the center, going outwards, and then discard the used antiseptic swab. I'm just cleaning the side. After doing that, we're going to prepare for the injection. So we're going to get our syringe and uncap the syringe and hold the syringe using a dominant hand and use a Z-track method, and we'll advise the needle into the patient's skin. So we're going to advance the needle at a 90-degree angle. And after doing that, we're going to aspirate, see if there is a blood that will appear on the plunger. If there is, we're going to remove the needle and discard the syringe and get a new one. If there is no blood, then we can insert or we can administer the medication steadily and slowly. Now, we're going to remove the needle from the patient's body at the same angle it was inserted and then apply pressure to the injection site. And Discharge the syringe into a waste receptacle to avoid needle prick injury. So, okay ma'am, we're done with your intramuscular injection. How are you feeling today?
I'm feeling great.
Okay, that's good to hear. So now that I am done, I'm going to head out now and let you some rest, okay? If you need something, you can press the call button and notify the nurse station, and I will come back to attend your needs, okay? Okay, thank you, ma'am. After doing the procedure, discard the gloves used and perform the aftercare of the equipment and proceed the documentation process of the procedure done.
Uy, di iposan ako. Nilock pa di. Ang Hindi ko katawag.